Have you ever stood up from your favorite chair and felt your knees complain? Or maybe you push off the armrest so hard your shoulder aches afterward? Or you rock forward 2 or 3 times before you finally get enough momentum to stand? If any of that sounds familiar, you are not alone. And here's the truth. The way most people over 60 get up from a chair is actually working against their body, not with it. Today, I'm going to show you the right way to stand up from a chair, a way that protects your knees, your back, and your balance. It takes just a few minutes to learn, and once you learn it, you'll wonder why nobody showed you sooner. Stick with me to the end, because I'm also going to show you the most common mistakes people make when standing up, mistakes that quietly wear down joints over the years, and one simple strengthening move you can add to your week to make every single stand-up easier for the rest of your life. Let's get into it. Let's talk for a moment about why something as simple as standing up from a chair deserves its own video. Here's the thing. Most of us stand up from a chair 5, 10, maybe 20 times a day. Every time you get up from the dinner table, every time you get up from your recliner to answer the door, every time you get out of the car, off the toilet, off a park bench, off a pew at church. That's not a small number. Over the course of a year, that adds up to thousands and thousands of repetitions. Now, think about it this way. If you do something the wrong way one single time, it's probably not a big deal. Your body can absorb that. But if you do something the wrong way thousands of times a year, year after year, decade after decade, those small stresses add up. They add up in your knees. They add up in your lower back. And they add up in your shoulders, especially if you're the type who yanks on furniture to pull yourself up. As we get older, our joints change. It's simply part of life, and there's no shame in it. The cartilage that cushions our knees gets a little thinner over time. Our muscles, especially in the legs and the core, naturally lose some strength if we don't actively work to maintain them. Doctors sometimes call this sarcopenia, but you really don't need to remember that word. Just know this: after 60, our bodies benefit from a little more care and attention with everyday movements we used to do without thinking twice. Organizations like the National Institute on Aging and the CDC both highlight that one of the biggest health risks for older adults is falling. And here's something a lot of people don't realize. A lot of falls don't happen while walking outside or climbing stairs or doing anything dramatic. A lot of falls happen during simple transitions, standing up, sitting down, turning around, reaching for something nearby. The moment you go from sitting to standing is actually one of the more vulnerable moments for your balance, because your body has to shift its center of gravity, engage several muscle groups at once, and stabilize itself, all in the span of 1 or 2 seconds. So when we talk about getting up from a chair the right way, we're not just talking about comfort. Although comfort matters plenty, we're talking about real, practical benefits that touch your whole life, protecting your knees. So you can keep gardening, keep walking the dog, keep chasing after grandkids, keep doing the things that bring you joy, protecting your lower back, so you're not wincing every time you stand, and so you're not dreading long car rides or long meals, because you know getting up afterward will hurt, building and maintaining leg strength, because standing up from a chair using proper form is actually a fantastic, gentle strengthening exercise in itself, one you're already doing dozens of times a day, whether you realize it or not, and reducing your risk of losing balance during that sit-to-stand transition, which in turn lowers your risk of a fall, something that matters more than almost anything else for staying independent as we age. Here's some encouraging news, too. This isn't about needing special equipment. It isn't about needing a gym membership or an expensive piece of machinery. It isn't about doing anything dramatic, intense, or intimidating. It's about relearning a movement you already do every single day and doing it just a little bit smarter, a little bit more efficiently, and a lot more kindly toward your joints. Think of it like this. You wouldn't lift a heavy box off the floor by bending your back and yanking it up, right? Most of us know instinctively to bend our knees, keep our back straight, and let our legs do the heavy lifting. Standing up from a chair works exactly the same way. There's a smart way to do it, using your strongest muscles in the right order. And there's a way that quietly punishes your joints, using momentum and your weaker muscles to compensate. Today, we're going to make absolutely sure you're doing the smart way, every single time. One more thing before we move into the how. This video is designed primarily for people who are generally mobile and can already get up from a chair on their own, even if it currently feels wobbly, effortful, or uncomfortable. If you use a walker, a cane, or you have a specific medical condition affecting your mobility or balance, many of these cues will still be genuinely helpful to you. But please work together with your doctor or a physical therapist to adapt them safely to your particular situation and needs. And speaking of which, as always, please check with your doctor before starting any new movement routine, especially if you have joint replacements, recent surgeries, osteoporosis, or balance concerns of any kind. We'll remind you again at the very end, but it's worth saying clearly right up front too, because your safety always comes first. All right, with all of that said, let's get into exactly how to do this one careful, simple step at a time. Before we even talk about movement, let's talk about the chair itself, because the chair you choose matters far more than most people would ever guess. For practicing this technique, choose a sturdy chair with a firm, flat seat, not a soft, sinking couch cushion, and not a deep recliner that swallows you up the moment you sit in it. A solid dining chair, a kitchen chair, or a firm armchair is ideal for practice. Ideally, the seat height should allow your knees to sit at roughly a 90-degree angle when you're seated, with your feet resting flat and comfortably on the floor. If your favorite chair at home is too low, that alone is one of the biggest reasons standing up feels so difficult and effortful. The lower the chair, the greater the distance your body has to travel to reach standing, and the more strain that puts through your knees and hips with every single repetition. We'll talk a little more about seat height in the mistakes section coming up later in this video, because it's genuinely one of the most overlooked factors in making chair transfers easier. For now, if you're following along and practicing with me today, go ahead and find a solid, sturdy chair nearby. Here's where most people go wrong before they've even started the actual standing movement. Many of us try to stand up from way back in the seat, deep in the chair, which means the body has to travel a much greater distance to get to standing. And because of that greater distance, people end up needing extra momentum, rocking back and forth once, twice, sometimes 3 times, or grabbing onto something nearby just to get enough force to rise. Instead, we're going to use a simple depart habit I like to call scoot and set. First, scoot your body forward in the seat, so that you're sitting toward the front third of the chair, not falling off the front edge. Nothing dramatic, just far enough forward that your body weight is more centered over your feet, rather than behind them. Second, set your feet deliberately. Place your feet flat on the floor, about hip-width apart, so you have a stable, balanced base. Now here's the key detail that changes everything. Slide your feet back slightly, so that they sit just behind your knees rather than out in front of them. Why does this small adjustment matter so much? When your feet are positioned slightly behind your knees, your leg muscles, particularly your thighs and your glutes, are in a much stronger mechanical position to push your body upward. But when your feet are out in front of you, which is what a lot of people do without even noticing, you end up leaning backward and you're forced to launch your body forward just to get moving. That launching motion is exactly where all that rocking, that momentum, that awkward lurching forward comes from. Go ahead and practice this position now right along with me. Scoot forward toward the front of the chair, feet flat on the floor, hip-width apart, positioned just behind your knees. Good. Take a moment to notice how that feels. A little more alert, a little more ready, a little more balanced already, even before you've stood up at all. This next part is genuinely the piece that changes everything, and it's the part that almost nobody does naturally, simply because nobody ever taught us to. Before you even think about pushing yourself up to standing, lean your chest forward over your knees. Picture yourself gently nodding hello to someone sitting across from you, a smooth, controlled forward hinge that begins at your hips while keeping your back reasonably straight, rather than rounding forward through your shoulders and spine. This forward lean accomplishes something quietly important. It shifts your body's center of weight forward, out over your feet. before you ever attempt to actually stand up. And this means your legs, your strongest muscles, get to do the real work of standing, instead of your lower back muscles or your arms having to compensate and take on strain. They weren't designed for. Let's practice this together one more time slowly. Sit tall in the chair. Scoot forward. Feet set just behind your knees. Now, hinge forward from your hips, as though you're leaning in to smell a flower resting on a low table in front of you. Let your chest move gently toward your knees. Notice something important here. Your back stays relatively straight and long throughout this movement. You are not rounding your shoulders forward or curling your spine. You are hanging cleanly at the hip joint, the way a drawbridge slowly and smoothly lowers down. Here's a simple little phrase to help you remember this position, and it's one that physical therapists use all the time with their patients, nose over toes. As you hinge forward from the hips, imagine bringing your nose out over your toes. This mental image tells you that you've leaned forward just enough to shift your weight into a genuinely strong, stable position. If you were to stand up right at this exact moment, your legs will be doing all the lifting, not your lower back, not your arms, not your momentum. Now, a lot of people feel hesitant to lean this far forward at first. It can feel unfamiliar, even a little unnerving, almost as though you might tip forward out of the chair. But please trust the process here. This forward weight shift is precisely what makes standing up smooth, controlled, and confident, instead of a shaky, effortful struggle. Let's try it together right now. Hinge forward until you feel that your nose is roughly positioned above your toes. Take your time here. There's no rush at all. Now, and only now, once your weight is properly shifted forward, do we actually stand up, with your chest leaned forward and your body weight shifted over your feet. Push down firmly through your heels and gradually straighten your legs to rise up to standing. Picture yourself pushing the floor away from your body with your feet, almost like you're pressing off the ground, rather than pulling your body upward using your arms or your back muscles. As you rise upward, allow your torso to straighten gradually and naturally, finishing the movement standing tall, with your shoulders comfortably back and your chin level and relaxed. Let's put the whole sequence together now from the very beginning, nice and slow. 1. Scoot forward in the chair. 2. Feet flat on the floor, hip width apart, position just behind your knees. 3. Hinge forward from your hips, remember, nose over toes. 4. Push firmly through your heels, straighten your legs, and rise smoothly to standing, letting your torso unfold naturally as you come all the way up. Notice how much smoother and more controlled that feels compared to before. No rocking back and forth, no grabbing desperately at the armrest, no jerking your body forward with momentum. Just a smooth, deliberate shift of weight, followed by a strong, confident push through the legs. Now, let's talk for a moment about your arms, because I know quite a few of you watching are wondering, is it okay for me to use my hands to help push myself up? Here's the honest, balanced answer. It really depends on where you currently are with your strength and your balance. And there's no single right answer for everybody. If you're generally quite steady on your feet already, and your main goal right now is building strength over time, try practicing this movement without using your hands at all, simply crossing them gently over your chest or resting them lightly on your thighs. This approach forces your legs and your core muscles to do the real work, which is exactly what helps build strength gradually and safely over the weeks and months ahead. On the other hand, if you currently experience knee pain, ongoing balance concerns, or you're recovering from a recent illness, surgery, or injury, it is absolutely fine, sensible, and genuinely smart to use your hands for a bit of extra support during this movement. But here's the key distinction to keep in mind. Instead of grabbing tightly onto the armrests and hauling yourself upward using your arms and shoulders, try placing your hands gently on your thighs, just above your knees, and press down lightly through your hands as you simultaneously push upward through your legs. This is a meaningfully different motion from pulling hard on a walker handle, a cane, or an armrest using mostly your upper body strength. This gentler approach still allows your legs to do the majority of the work, while giving you a bit of added stability and confidence along the way. Now that we've walked through each individual piece of the sequence, I want to encourage you to spend a few minutes practicing the whole movement slowly. and deliberately, several times in a row without rushing. Here's a simple way to build this into a short daily practice. Sit down in your sturdy chair, take a breath, then run through the full sequence, scoot forward, set your feet. Hinge at the hips with your nose over your toes, then push through your heels to rise. Once you're standing tall, pause for just a moment and then sit back down slowly and with control. Using the same principles in reverse, hinge slightly forward as you lower, and let your legs control the descent rather than simply dropping into the seat. Try repeating this sequence 5 to 8 times in a row, once or twice a day, if it feels comfortable and appropriate for you. Over time, this repetition does two wonderful things at once. First, it reinforces the correct movement pattern until it becomes automatic, something your body does naturally without you even having to think about it consciously. Second, because you're using your leg muscles properly with each repetition, you're quietly building strength in your thighs, hips, and core every single time you do it, turning an everyday necessary movement into a genuine mini strength training exercise. If you'd like to build extra leg strength specifically to make this movement easier over time, here's a gentle bonus exercise you can try, always with your doctor's approval first. Stand in front of your sturdy chair, facing away from it, close enough that you can feel the seat lightly against the back of your legs. Slowly lower yourself down as though you're going to sit, using the same hip hinge principle we just practiced. But stop just before your body actually touches the seat, hovering there for a second or two. Then push back up to standing using the same technique, nose over toes, push through the heels. This little hovering pause adds extra time under tension for your leg muscles, which can help build strength a bit faster. Start with just a 1 or 2 second hover, and only if it feels safe and comfortable. Always keep the chair directly behind you in case you need to sit down at any point. Now let's talk through some of the most common mistakes people make when standing up from a chair, so you can watch out for them in your own daily life. Mistake number 1, sitting in chairs that are too low. As we mentioned earlier, a chair that sits too low forces your body to travel a much greater distance to reach standing, which places significant extra strain on your knees and hips with every single rise. If you have a favorite chair at home that feels particularly difficult to get up from, consider adding a firm cushion to raise the seat height slightly, or look into chair risers, which are simple blocks that lift the legs of furniture. Mistake number 2, using momentum instead of control. Rocking back and forth several times before launching yourself forward might get you standing, but it means your body isn't building genuine strength, and it puts sudden, jarring stress through your joints rather than smooth, controlled force. If you notice yourself doing this, that's a helpful signal to slow down and revisit the scoot and set technique we practiced today. Mistake number 3, pulling on unstable furniture. Many people reach for a nearby side table, a shaky chair arm, or even a windowsill to pull themselves up. The trouble is, these objects often aren't designed to bear that kind of weight, and if they shift or tip, that can lead to a fall. Always make sure whatever you're using for support is sturdy and secure. Mistake number 4, rounding the back instead of hinging at the hips. When people don't hinge properly from the hips, they often compensate by rounding their upper back and shoulders forward instead. Over time, this pattern can contribute to lower back strain. Remember our cue: nose over toes, hinging from the hips, back reasonably straight. Mistake number 5, rushing the sit down. We often focus so much on standing up carefully that we forget sitting back down deserves just as much attention. Dropping quickly into a chair rather than lowering with control puts a jarring impact through the knees, hips, and spine. Practice sitting down just as slowly and deliberately as you practice standing up. Mistake number 6, holding your breath. It's common to unconsciously hold your breath while pushing up to stand, especially if the movement feels effortful. Try to breathe out gently as you push up to standing, which can also help prevent dizziness. Let's do a quick recap of everything we covered today. Scoot forward in your chair. Set your feet flat, hip width apart, just behind your knees. Hinge forward from your hips, keeping your nose over your toes. Push firmly through your heels to rise to standing, letting your torso unfold as you go. And use your hands lightly on your thighs rather than yanking on furniture if you need a little extra support. This simple sequence, practiced consistently, can make a real difference in how your knees, back, and balance feel every single day, simply because you're doing something you already do dozens of times daily, just doing it a little smarter. If this video was helpful, please consider giving it a like and subscribing to the channel for more simple, practical videos designed specifically to help you stay strong, steady, and independent as you age. Drop a comment below and let me know how this technique felt for you, or if you have a chair at home that's particularly tricky to get up from. And finally, as always, please check with your doctor or physical therapist before starting any new exercise or movement routine, especially if you have joint concerns, recent surgeries, or balance issues. Everybody's body is different, and a quick conversation with your healthcare provider can help make sure this is the right fit for you. Thank you so much for watching, and I'll see you in the next video.